So hi everyone, I'm here with Lora Shahine, and she's a medical professional, reproductive endocrinologist out of Seattle with
Pacific Northwest Fertility.
Right. And so today we're talking about miscarriage and her books and a lot of her passion around the topic of what happens when the pregnancy doesn't come to full term.
Yeah. I opened up a center for recurrent pregnancy loss in 2010 after I came to Seattle and started in the practice. And it really came from, in my training, I did my fellowship at Stanford when they were opening up a recurrent pregnancy loss center there. So I learned a lot being in the right place at the right time. It was a real collaborative effort with different medical providers from lots of different fields, immunology, gastroenterology, hematology, all these people kind of coming together. And when I went to Seattle, I realized that there wasn't anybody that was really focused on recurrent miscarriage there. And I realized that in collaboration with my mentor down at Stanford, we could really do something special. And since then, I've cared for many women and many couples that are really struggling to conceive and learned a lot in the process, mainly learning the most from my patients.
What are some of the most common questions or concerns that a patient has when they do have multiple miscarriages? Do they blame themselves? What are some of the thought processes and things that they're telling themselves?
Yeah. Why? Why did it happen? I know it's my fault. I know that I'm broken. Tell me what I did wrong. Tell me what's broken, and then I can fix it so that the next time I get pregnant, I don't have to have this pain again.
So they self-blame.
Absolutely.
Mm-hmm.
Yeah. I mean, for millennia, for as long as you can remember, anything that has to do with reproduction is the woman's fault. Whether it's difficulty conceiving or having miscarriages, it's always the woman's fault. And, women are doing a really great job of kind of feeding into that.
Mm-hmm.
And the most common cause of miscarriage is a chromosomal issue in the embryo, a genetic issue, and it's random, and it's something that comes together with that particular egg and that particular sperm. And fertilization can happen, implantation can happen, the pregnancy can develop, but at some point it just stops developing, and the pregnancy doesn't continue. But the woman and men, they worry too. Was it a glass of wine that I had? Was I too stressed out? Should I have been working? Absolutely. Men
Mm-hmm.
worry about intercourse. It happened after, we had intercourse, and the men blame themselves.
Mm-hmm.
And so, they come to me for evaluation, and we do a, evidence-based traditional evaluation where you're looking at the people that are trying to conceive. And when you're doing that, you're looking at anatomy and blood tests and all these things that you can test in the people that are getting
Mm-hmm.
pregnant, but most of the time we don't find anything because it's really within the embryo.
Mm-hmm.
And that's, on one hand, it's very frustrating because people want that answer, and they want a pill that they can take or a procedure they can do to make sure they don't have another miscarriage. But on the flip side, every pregnancy is a new opportunity. So every new pregnancy is a new egg and a new sperm, and it can always be successful. So walking somebody through that and really changing the mindset away from there's this intense problem that absolutely has to get fixed or it's my fault, to doing a complete evaluation, answering the questions, but really thinking about all the options.
So the pregnancy that had the miscarriage doesn't necessarily mean that the next pregnancy will result in the same thing. It just, when there's multiple ones, you start blaming and thinking that you did something yourself.
Yeah, I mean, I think even with one miscarriage, people worry that something's wrong. I mean, we're really taught in high school health ed that the norm in our story is that it's easy to conceive, and we spend our whole lives trying not to get pregnant. And then when we stop contraception, we're ready to conceive. When the family doesn't come as quickly as we want, we feel like there's something wrong.
I understand. So tell us a little bit about your books and how that can help the patients that are reading them.
Sure, absolutely. So the first one is really It's Not Broken, an approachable guide to miscarriage and recurrent pregnancy loss. And I really wrote this after I realized that even within an hour consult, nobody can absorb everything that I'm saying. Like, I talk about the tests that we're doing and I talk about the treatment options, but people leave, I think, knowing that they're in good hands, but they don't really understand what we're doing. And so I just wanted them to have a resource where they could look and see, why are we doing this particular blood test? Why are we checking the uterus? What are we looking for? What are the treatment options? And really, it has everything from, each test to each treatment option to controversies in care, because, there's so much out there that's really gray in the area of miscarriage.
Or conflicting advice.
Exactly. There's a whole chapter on just emotional well-being and support, which I think is really important. And then there's a chapter on men, because they often get left out of the conversation.
Yeah, that is very important. So it's kind of like a homework guidebook to build off of what they learned when they were with you.
Right. And I want it to be a resource. The point of it is to help people understand and hopefully learn how to be an advocate for themselves. And I understand that, we can't see every single patient, but it's a way that people could maybe get information and have a really fulfilling conversation with the provider that they're seeing.
Right. Yeah, that's really great. I think, there's been many different stories that we've told on both the Experience platform and the Egology Club podcast that have talked about either a miscarriage that had been in the past that maybe they didn't openly talk about. And I think that there's a stigma with it, right?
Absolutely.
And so with that stigma kind of fading away and people being a little bit more open and like the rainbow babies and, some of the celebrities talking about it, I think it's definitely helping change that stigma so it's not so self-deprecating or feels like, you were the cause of the problem.
Absolutely. 1 in 4 pregnancies end in miscarriage, and it's so common, and people feel so much shame, and even providers are adding to it. So just in general, there's this feeling like, oh, you're pregnant, that's great, but don't tell anybody just in case, right? Until the end of the first trimester, don't tell anybody just in case, because that's the most common time for loss. And so then
we're setting them up for thinking about losing it.
Yeah, we're setting them up so that if they do have a miscarriage, they haven't told anybody, and exactly when they need support, they're isolated.
Right, because now how can I tell you about a pregnancy that's over when you never knew I was pregnant to begin with?
Right.
Now, just clarify for us, that's the same type of pregnancy loss can happen in both IVF and natural conception, correct? It's not a deterrent that if you did IVF, you have a better chance of success, although we can do some testing on those embryos.
Yeah, so that's a great question. So IVF is appealing for women who've had recurrent loss if they know that the pregnancy losses are from a chromosomal issue.
Okay.
So in IVF, when the embryos are outside of the body, you can test embryos to make sure they have the right balance of chromosomes. So you can decrease someone's risk of miscarriage from a very particular thing.
Okay.
You can decrease their risk of miscarriage from a chromosome imbalance.
Got it.
But women that do go through IVF and do screen their embryos, they still can have a miscarriage. So it's not black and white.
Right. So there's some room there that science and just the body will take over. Do you have any strong opinions or medical advice on the thought process behind that the reason a miscarriage happens is because the body is telling you that it's not going to be a healthy embryo to bring to fruition?
Sure. So I think there's a couple of different ways to look at it. I think what a lot of women or lay people do is think that their body is rejecting this perfect, healthy baby or embryo. And I really believe that most of the time it's an embryo that is not destined. It doesn't have the right chromosome content. At some point, some gene is missing or there's too many copies. And that the woman's body is actually working. It's actually getting that signal that, this is not going to be a healthy baby. And so we know that this is not going to continue. But
miscarriage is going to happen at any phase of the process. And so it's a little harder, I think, or maybe not ranking it, but there's a little bit more of when the baby looks and feels and is farther along in the process, what can we contribute the pregnancy loss at that stage? Like if it's second trimester?
Oh, sure. Great question. So reproductive endocrinologists like me and most recurrent pregnancy loss specialists are focusing on first trimester losses. And in second and third trimester, there can be things, more anatomical issues like cervical incompetence, or some blood clotting issues, or a lot of times in stillbirth, you kind of get closer and closer to delivery. Most of the time we do a thorough evaluation, and we don't know why either. Yeah.
I think, miscarriage is kind of like almost like cancer in the sense where we kind of all know somebody that went through it, but we may not know how to support them. So I know you have a resource for supporting somebody that that has had a miscarriage.
Yeah, absolutely. So, in American culture and a lot of European cultures, there's really no dialogue. There's no script to know what to say to people or what to do when they have a miscarriage. And a part of that is just the stigma and isolation and worrying about it being your fault, so you don't want to share. But in some other cultures, like in Japanese cultures, oftentimes people will buy what's called a Jisoo doll and place it in cemeteries and really or in their home to sort of watch over the souls of lost children. And sometimes people will give it to each other, and there's just this
camaraderie or family unit.
Yes, and mainly a recognition of how important this is, no matter how far along it was. Kind of going back to what you were saying, like some people will just have even I just said the word just, but they'll have a positive pregnancy test and like a late miscarriage, and we call that a biochemical miscarriage. And sometimes providers will just sort of blow it off, or friends will blow it off and be like, oh, that wasn't a real pregnancy, you're fine. So there's just there's a way to sort of recognize that it is a loss.
That you were pregnant for even if it was a small period of time, you were pregnant for some stretch of the way where there could have been a life.
Right, and you have these hopes and dreams, and you're already kind of imagining what life will be, even with a positive pregnancy test. And if it ends at any point, that it is a real loss. And so I have created a book that really I imagine people giving it to each other, and it's a small gift. It's sort of the size of a greeting card, and it's called Not Broken, sort of an illustrated version. And it's basically the cover of the book is really showing a ceramic bowl that's been broken, and then it's been put back together, and it's sealed with this gold lacquer, and it's a representation of this Japanese art form called kintsugi. And it's also a philosophy that we're all broken, and when you come back together, it's the cracks and it's the grief and it's the resilience that you've built through going through these difficult times that make us even more beautiful. And so in this book, it's basically talking about how when you're pregnant and you're expecting hopes and dreams. But when you miscarry, the bowl is shattered, and you feel shattered, and you feel isolated, you feel alone, but that there's encouraging words like you're strong and you're brave and you're not alone, and you can put the bowl and yourself back together, and you're not broken. And so it's the philosophy of the cover of my original book, but I was able to just illustrate it and put it into words. And I just, there's a little bit of...
And help process those emotions.
Exactly.
And come to terms with maybe the next steps for how your family can be built.
Exactly.
Yeah. That's really great.
Well,
thank you so much for just talking to us about this whole concept, because I think it's a little bit misunderstood and obviously can have more awareness around it. So you can check out... You want to tell everybody how to get a hold of you?
Absolutely. So I have a website, just lorashahine.com. And then I really try to do a lot on social media to try to get a positive message out there at Dr. Lora Shahine and Instagram and Twitter and Facebook.
Great.
So thank you so much.
And then you can buy your book on Amazon.
That's right.
Yep. Awesome. But thanks for your time today.
Thank you.
All right.